Okay, I'm going to do a quick review of the patho behind red blood cell breakdown to help you better understand jaundice in the newborn. So first, we have the breakdown of red blood cells. This is called hemolysis. Once the red blood cells are broken down, it releases hemoglobin, which is then further broken down. And then after that, the hemoglobin gets converted into unconjugated bilirubin. So unconjugated bilirubin is not water soluble, which means that it can't be excreted through the bowel or the kidneys. So we need to find a way for it to be excreted through the bowel and kidneys. How does it do that? It has to hitch a ride over to the liver. And to hitch a ride over to the liver, it's going to bind to albumin. And it travels down to the liver. And then once at the liver, that's where it's going to be conjugated. It becomes water soluble and it can pass in the bowel and the kidneys. Then after that, we still need a way to get it to be able to be excreted in the stool. So we are going to secrete this into the bile so it can travel down to the intestines, and then it gets excreted in the stool. Okay, let's go over why jaundice happens in the newborn specifically. So there's a few things that contribute to this. First is newborns have more red blood cells, and these red blood cells also have a shorter lifespan, so that causes increased red blood cell breakdown. Newborns also have immature livers, so after the red blood cells are broken down and it gets turned into bilirubin, their liver is not able to process it as well. And then another thing that contribute is if baby's not feeding as well, they may have fewer stools, and that can also cause less bilirubin to get excreted. So there's two types of jaundice. Physiologic is when it's after 24 hours, and this is our more mild, non-concerning, self-limiting jaundice. It's typical to find in newborns, and it's just due to the babies having immature livers. Now, pathologic jaundice is when it's within the first 24 hours. This is caused by rapid rise of bilirubin, and this rapid rise of bilirubin is typically due to an underlying issue that's causing hemolysis. So the hemolysis, which is breakdown of red blood cells, can be caused by things like ABO incompatibility, RH incompatibility, or bruising. Now, ABO and RH incompatibility is essentially just when mom's blood cells sees baby's blood cells as being foreign, so then it attacks baby's red blood cells and destroys them, causing hemolysis. So ABO is going to be our more common incompatibility. RH incompatibility is going to be the less common one, and it's also going to cause more severe hemolysis. To assess, we're going to want to assess every 8 to 12 hours, and we're going to check for blanching. So we're going to press the skin and look for yellowing, and we can press on the nose, sternum, the head, and also inspecting the eyes for yellowing. Jaundice starts from the head to toe, with the head, face, and neck being the first area, and then whenever it disappears toe to head. So there's also, we can do the TCB light test. That's typically done during 24-hour testing or checked earlier if we're more concerned, and it takes an average of 5 readings. And then a lot of times now we use either the nonogram or in Epic, there's a Billy calculator to help us calculate this. And it's important to look at the rate of rise is really what we're wanting to look at the most there. Ways to prevent this is early, frequent feeding to help promote the passage of stool and urine, and then remembering that colostrum is important because it acts as a laxative. And then, last but not least, treatment is the phototherapy, that little blue light. It converts the bilirubin into an excretable form. There's a couple of things to keep in mind for this. Infant must be in their diaper, can't be swaddled or in clothing or anything because we want maximum skin exposure. Infant will also need eye protection and be turned every 2 to 3 hours. We want to monitor temperature and hydration status, and then no lotions because this can cause a risk of burns for the newborn. But that is just a little overview of jaundice in the newborn.